Of course, throughout the month of October, we'll be taking a look at breast cancer awareness, and today we're focusing on preventative and early detection tools. One very important one is genetics testing. And here to tell us more about the importance of genetics testing, Dr. Colleen McMurdo, who's clinical geneticist with Baylor Scott & White, and Stephanie Thompson, clinical genetics counselor with Baylor Scott & White. And it's great to have you both here today. What exactly is a genetics test? Stephanie, I mean, you work with patients.
I do.
In doing this testing.
Yes. So we know that our body contains genetic information, and each gene has a different job. There are certain genes that their job is to prevent tumors and cancers from forming. And so genetic tests are often blood tests that look at those genes to see if there are any changes or mutations that could cause that gene to not do its job.
Dr. McMurdo, as a physician, why is it so important for women to look at maybe this kind of testing? What are some of the things they need to be aware of?
Yes, so all women, are recommended to have their mammogram at 40. But
Sure.
if you have a hereditary form of cancer, sometimes we make that screening start earlier, sometimes as young as 25. And so it's important for us to know what recommendations we have, not only in your treatment, but screening, and then also to know what's the risk for other family members.
Well, I know there are these tests folks can take to learn about their ancestry and all that. Do folks get a little confused about whether that's genetics testing or not, Stephanie?
Yeah, we get that question all the time in clinic, and a test that is direct to consumer, like 23andMe, is not the same as a clinical genetic test that's ordered by a physician. It doesn't test for as many changes and doesn't give us as much information.
So when a woman says, I've got an aunt who was diagnosed with breast cancer, I really need to kind of keep an eye on this. What's the first thing they need to do, Dr. McMurdo?
First thing I would do is talk to your primary care physician about what screening is recommended for you. But if you have a concern, we'd always be happy to see you in genetics clinic to talk about your family history, your personal history, and what testing panel would be best for you.
Okay, so apparently there are lots of different ways they can screen. Is that right? I mean,
Yes.
You mentioned, is it always going to be a blood test or?
Usually a blood test. At times we can do a saliva sample, but in our clinic we usually order blood.
So what is it that you found through genetics testing when it comes to actually treating a patient?
So some patients will have opportunities to use different medications that we know are more or less effective because of the genetic changes that we see. Sometimes we increase that screening not only for maybe breast cancer, but for other cancers that risk for, like ovarian cancer or colon cancer, that they might not be experiencing at that moment, but also and then being able to talk about those risk factors for other family members.
Of course, the good thing about October being Breast Cancer Awareness Month is that women are made more aware of it. Maybe, I haven't had a mammogram this year. It's time. It's sort of their reminder. Some ladies like to use their birthday, for getting those kind of medical tests done. But you see more and more women in October, I suspect.
Absolutely. I think it's a great thing. What you should do is sign up to get your mammogram and go in and get your flu shot.
Good idea. Spoken as a doctor there. All right, so how can folks get in touch with you to learn more?
So they can go right onto our website for Baylor Scott & White, and you can say make an appointment, and they'll send you out some information, or mainly I would talk to your primary care physician to have them place a referral to come see us.
Oh, thank you both so much for taking some time to be with us. And again, if you haven't had that test, go ahead and get your mammogram, and if you need more testing,
Absolutely.
you know where to go.